Hi, how are you doing? Hope you're doing well. So for today's videos, I will talk about patient sitter, also known as patient safety attendant. So a quick summary of this job. As a patient sitter, you mostly work under the supervision of a nurse. Now, for your main duty as a patient sitter is to observe and maintain the patient condition and patient behavior. So if there are any changes to the patient, either condition or behavior, you have to tell the nurse immediately. So the nurse will come in and fix the situation. Now, as a patient sitter, most of the time you will work in the medical setting. So as a patient sitter, right, you're probably going to work in the hospital, nursing home, or assisted living facility. For this medical setting, most of the time you will assist the patient with the basic necessity for their daily activities. So like eating, walking around, moving around, dressing, stuff like that. For this job requirement, all you need is to have a high school diploma or something like equivalent to that, and also a CPR card. Most hospitals nowadays, they want you to have a BLS for healthcare provider. So you could get this through the AHA, so American Heart Association. This is very easy to get. It's just pretty much 1 day of training for the CPR training. So as long as you have your high school diploma and your CPR card, then you're good. So how much will you be making as a patient sitter? So according to pay scale across America, the average pay for this job is around $11 an hour. So around $11 an hour. Now this could be either lower or higher based on where you live and your experience. So if you have more experience, you might get paid more. So, but again, this is a good entry-level job into the medical setting if you are interested. So here are the main duties as a patient sitter. Number one, the most important one is you provide one-on-one. So one-on-one direct patient observation. So you literally sit next to the patient. On the patient probably can be on the hospital bed or on their medical bed. You have to be right next to the patient, observe the patient, make sure the patient is safe, and this depends on the patient condition. So if you're there for patient condition, safety wise, make sure the patient doesn't fall off the bed. Usually most of the patients you will be watching are fall risk patient. So you don't want a patient fall off the bed. If they have behavior issue, then you usually want to make sure the patient doesn't hurt himself or hurt other people. So most of the time as a patient sitter, your condition of the patient and the safety of the patient. So therefore you need to understand vital sign. Understand the vital sign. If there are any changes to patient vital sign, you have to let the nurse know immediately. And then also you need to understand patient intake, daily intake. So anytime the patient eat like breakfast, lunch, and dinner, right? You have to wrote down the patient intake. So how much the patient eat, how much the patient drink. So your food and liquid intake. And after that, you hand it to the nursing staff. Now, most of the time, if the patient could move around or have general weakness, you will help the patient move around. Let's say move from bed to a wheelchair, move from bed to a chair, move from bed and take a walk around the area or go to the restroom and help the patient change if you are working in the nursing home. So there's a lot of tasks as a patient sitter, but most of those tasks are basic tasks that you just think helping an elderly patient. So those are your main tasks as a patient sitter. So just be sure that you keep an eye on the patient, and if there are any major changes to the patient, let your nurse know. Well, I hope you learned something new from this video. What is your thought on patient sitter job? Let me know down in the comment. And like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Well, I hope you take care of yourself. I will see you again on the next video. Bye. Love yourself, trust yourself, and stay safe. Bye.